diagnosed the patient with allergies and prescribed antihistamine. She went into respiratory distress, and you injected her with epinephrine. Presumably 1 cc.
0.1 cc. That is the standard dose. That is what I gave her.
People don't go into cardiac arrest from 0.1 cc epinephrine.
She must have a pre-existing heart condition that got exacerbated by the epinephrine.
It's too bad you didn't make a notation in the chart.
I can make it up right now.
The drawer has syringes with both dosages. You could have easily reached for the wrong.
But I did.
Everyone makes mistakes. This is why doctors pay through the nose for malpractice insurance.
Worst thing to do is whack my hand with a ruler.
And the discipline board, are they going to whack your hand too?
They're going to report me.
Which way story?
How about not report me?
I can justify keeping her here for a 24-hour observation. If you haven't found an underlying cause for the cardiac arrest by then, I will have to notify our attorneys.
Her hands were red and swollen. Maybe she has a skin infection. Cellulitis? That could manifest with tachycardia.
There's no history of fever. Results from the CBC didn't indicate an infection.
Eosinophils are mildly elevated. Separates up a bit. Could we be looking at a systemic allergic response?
It's not allergic. Allergies don't cause cardiac arrest like this. It could be inflammation of the blood vessels.
Vasculitis? That wouldn't give you an elevated eosinophil count.
Church-Strauss vasculitis would. Blood vessels at the heart, lungs, and skin become inflamed, causing the asthma, rash, and heart problems. Covers all her symptoms.
Need a biopsy to diagnose.
Chest CT, be quicker. The lady just came in with a rash.
What the hell are those?
Candy canes?
Candy canes? Are you mocking me?
No. It's Christmas, and I thought...
Relax. It's a joke.
Isn't the prognosis for Church-Strauss a bit grim?
Yeah. No.
What the hell are those?
Candy canes?
Candy canes? Are you mocking me?
No. It's Christmas, and I thought...
Relax. It's a joke.
Isn't the prognosis for Church-Strauss a bit grim?
Yeah. Untreated, only 33% of patients survive past a year. Treated 5 years.
And I definitely suggest treatment.
If it was any other attending doctor, I'd say that he made a mistake and gave you too much epinephrine.
Saying you wouldn't say it was my mistake, saying it was my mistake.
Everyone screws up. Your rule. I think you fit within the subset of everyone.
I didn't screw up. Order a chest CT and start the sister on prednisone, 40 milligrams TID.
The sister.
What didn't I mention? Patient's a nun. Sister Augustine.
Hate nuns.
Who doesn't?
Sister Augustine?
We weren't watching. We were trying to see if this is the bed control.
Oh, this one's the bed control, and that's the TV control. And Dr. Cameron, Dr. Chase, and Dr. Foreman. Haven't seen television in over 20 years.
Do you consider it the work of the devil, or do you just not get cable where you live?
How you feeling?
I seem to be a little better. They gave me some medication.
Prednisone. It's a steroid to help with the inflammation.
Has Dr. House figured out what I have? Will I be okay?
I'm not sure what's wrong yet. You'll have a chest CT scan this afternoon that'll help with the diagnosis.
Dr. House is giving her medication, and he doesn't know what she has.
Trust, Sister Pius.
It all happens for a reason.
He doesn't know what he's doing. The only problem that woman has is that House grabbed the wrong syringe.
You don't trust him?
I don't trust a man who won't admit he might be wrong. I noticed you weren't so quick to tell her she's got Church-Strauss and only has a couple of
Don't
years
tell
to live.
patients bad news unless it's conclusive.
Because you know he might be wrong.
About Church-Strauss, not about what happened in the clinic.
What about you, Chase? You think he's infallible, too?
All I know is if House didn't make a mistake and Sister Augustine has Church-Strauss, he'll be self-satisfied and our lives will be good for a few weeks. If House did make a mistake, he'll be upset and our lives will be miserable for months.
There is that.
If Cuddy thinks I made a mistake, the least you can do is suspend her from clinic duty.
She doesn't confuse making a mistake with being incompetent.
Oh, here we go. Lesson time. I recognize that confidence is not my short suit. I also recognize that I am human and capable of error.
So you might have screwed this up.
No.
So it's merely a theoretical capacity for error.
Good point. Maybe there isn't one. Maybe that's my error.
You know, most people who think as much of themselves as you do like to talk about themselves.
Most people don't like to listen. So what's wrong with you? bowel.
Wow, yeah. Is it that bad?
Yes. It's also written on the chart. Bloody diarrhea, gas, pain. Took sulfasalazine, but it didn't work.
No, then I,
Next tried steroid enemas, oral corticosteroids, 5-ASA, 6-mercaptopurine. I'm impressed
by my medical history.
by how well your last doctor charted.
It's one thing to have to go to the bathroom every hour, but when the kids sit on my lap... The store sent me home. They're going to fire me. Can't you put me back on 5-ASA? Maybe it'll work this time.
Not likely. I'll give you a prescription. It's cheap, which is good, because your insurance company won't pay for it.
Cojaritis?
Cigarettes. One twice a day, or no less. Studies have shown that cigarette smoking is one of the most effective ways to control inflammatory bowel. Plus, it's been well established that you're 30% cooler.
Are you kidding me?
About the looking cooler, yeah. The rest is true.
Isn't it addictive and dangerous?
Pretty much all the drugs that are prescribed are addictive and dangerous. The difference with this one is it's completely legal.
I was talking to the nurse. Arsenio, do you know him?
Not really.
He can take pictures with his phone.
Cool.
That woman from the lab was interesting, too. She studied astrophysics before becoming a nurse.
You know the stuff better than I do.
Well, I love to hear all about people.
Yet you live in a monastery.
It's where I serve our Lord and the world best.
Our world, maybe. The rest of the world, on the other hand, probably get more out of feeding the homeless or...
Healing the sick.
As an example, yeah.
Did you always want to be a doctor?
Always. You always want to be a nun?
My parents died when I was 6. I was raised in a foster home run by the church. When I was 18, I went to the monastery where they let me take my vows. I've known no other life, and I haven't wanted to.
Okay, sister. We need you to lie as still as possible. If you get scared, just let us know.
As Jonah said from inside the whale, I had lost all hope. I turned my thoughts to the Lord.
She's got God on her side.
I don't believe in God.
You're not even a little agnostic?
Brown.
It's normal, sister. It's just a few more minutes. I believe in a higher order that's in control of what happens, but not one anthropomorphic entity called God that's concerned with the everyday workings of you and me.
What else is there to control but the everyday workings of you and me?
It's always about you, Foreman.
So what are you talking about? The trees, the fish? Should they be the ones that think it's all about them? What about you, Chase? You believe in God?
I believe Sister Augustine has no vascular pathology, which means no choke Strauss.
Which means House made a mistake.
No, not necessarily. It could be something else. Thyrotoxicosis or a carcinoma.
I don't get you. You don't believe in God, but you're willing to put complete faith in one man?
Please. This smell.
Let's get her out of there.
I'm coming, sister. I gotcha. I'm coming. Oh, the smell. It's gonna be sick. There's no smell. Oh, no, God. It's Jesus. It's Jesus. He's coming for me. He's burning me with his touch.
Let's get her on some Ativan.
Oh,
It smells religious visions and symptomatic temporal lobe swelling. We don't want her to...
Oh, she's seizing. Trauma.
Help me get her on her side.
Religious visions?
Yeah. And next comes... Patient tested positive for herpetic encephalitis.
So what's that tell us?
Her immune system is severely compromised. Oh, I know. Prednisone compromises the immune system. Isn't that the medicine that you gave her for that thing she doesn't have?
Yeah, but... Hey... I'm thinking that's a trick question.
Her immune system is severely compromised. 2 doses of prednisone will do that. Are you hanging your diagnosis on an adverb?
In 10 seconds, I'm going to announce that I gave her the wrong dose.
Limited negligence?
Unless you leave the room. If you stay, you'll have to testify. 5, 4, 3, 2... So there I was, in the clinic, drunk. I open the drawer, close my eyes, take the first syringe I can find. So, what are the options for compromised immune system?
Mixed connective tissue disease. It'd explain why she was feeling better on the prednisone.
Sure, she was feeling better right up to the moment it almost killed her.
On the other hand, it explains the symptoms. Swollen hands, pulmonary problems, cardiac problems, it all fits.
Except her ANA was normal.
Redraw the blood.
Treatment is corticosteroids, prednisone, and we can't go there because of the encephalitis.
Then we'll treat it with something that modulates the immune system but doesn't suppress it. Hyperbaric oxygen chain.
There's no protocol for putting a patient in a high-pressure oxygen room to treat autoimmune problems.
Oh, you people, always with the protocols. Prep the nun. Discontinue the prednisone. I am both amused and annoyed that you think I should be less stubborn than you are.
You are aware of the Hippocratic Oath, right?
Starts first, do no harm, and it goes on to tell us no abortions, no seductions, and definitely no cutting of those who labor beneath the stone. Yeah, took a read once, wasn't impressed.
Hyperbaric treatments could cause oxygen toxicity. Lung and eye damage.
Every treatment has its dangers.
Which is why we only treat if we're convinced the patient actually needs the treatment.
I'm convinced. You're not. Question is, what are you going to do about it?
I have an opening Thursday at 3. Do you have a 4th? Is he any good? Can I call you right back? What's up?
The pressure will force the oxygen into your system, saturate your blood. It will enhance white cell activity, reduce the inflammation.
What's next? Connective tissue disease?
We'll be doing about 10 treatments and then we'll reevaluate.
The last treatment with prednisone causes seizures, right? How confident is Dr. House about this?
That you reacted so strongly to the prednisone let us know that you had an underlying problem with your immune system.
I guess it was a blessing. Of sorts.
But I saw you at the Christmas party with Dr. Miles. And Dr. And Scrandal.
I was just doing some Christmas dancing.
This is the chapel. The house of prayer.
That explains the good reception. Also, why nobody's ever here.
I need to talk with you, Dr. House.
Sister Augustine believes in things that aren't real.
That was a job requirement for you people.
She's been known to lie, to get sympathy. She's a hypochondriac.
So you're warning me that I'm treating a non-existent ailment.
Sore throats, joint pains. There's always something wrong. And there's never a reason for it. Mother Superior plays right into it. Lets Augustine off work duties, treating her as fragile, special.
That must make you angry.
Bothers me. It's not really in Augustine's best interest.
You want some?
I shouldn't.
I guess you gotta be good at reading people to be a good infirmarian, huh?
Mm-hmm.
So we got pride, anger, envy, gluttony. That's 4 out of 7 deadly sins in under 2 minutes. People keep records of these things as they're careful.
They say you have a gift.
They like to talk.
You hide behind your intelligence. And you make jokes because you're afraid to take anything seriously. Because if you take things seriously, they matter. And if they matter...
Things go wrong. I get hurt. I'm not tough.
And I don't know if I'm right. Just right. Because the alternative is... you really are as miserable as you say.
You know, from the way you're looking at me right now, I'd say you just hit number 5. You must.
Dr. Brown, I love you.
How you feeling?
A little weak.
That's from the oxygen.
My mouth is dry.
Okay, well, I'll get you some of your tea.
Mixed connective tissue disease? Her ANA is barely elevated.
Well, thanks for checking up on her. Good to know you got my back.
O2 sats down to 83. Pulmonary problems, breathing problems.
Irritation from the oxygen is typical.
She comes in with a rash and we put her into cardiac arrest.
That well just never runs dry. If there was no underlying problem, why is she still having a rapid heart rate?
Maybe from the herpetic encephalitis caused by you giving her
Her
prednisone.
reaction is a symptom, not an error.
There's always an explanation, isn't there?
Yes, there is. If this one doesn't work, we'll find another.
But never one involving you screwing up.
One that fits all the facts. Look, we obviously have a difference of opinion, and that's fine. But unfortunately, I've used up all the time I budgeted today for banging my head against a wall.
I'm going to do you the biggest favor one doctor can do for another. I am going to stop you from killing your patient. You're off the case. We're going to treat the symptoms, not the underlying condition. There is no underlying condition. What's her status?
The sister's breathing is labored.
Pneumonitis from the hyperbaric chamber put her on 40% oxygen until her O2 sats increased.
BUN and creatinines rising, ALT and AST twice the normal range.
Could be from the hypotensive episode. Let's follow them with labs.
She still has the rash and joint pain she came in with.
Order a non-steroidal anti-inflammatory.
When we were looking at the differential diagnosis of Dr. House, we were considering...
I don't need to hear what Dr. House was considering. All of this woman's symptoms can be traced to Dr. House's considerations. Okay. Let's just get this patient healthy. I want her going out the front door and not the back.
Hey, it's not like I betrayed you. Cuddy would have found out about the hyperbaric treatments eventually.
You did what you felt you had to.
Can't get enough of this place, huh?
Came from my stethoscope.
So I shouldn't read too much into the fact that you were looking for it in the drawer with the epinephrine syringes in it?
Okay. I'd like to defend my reputation. reputation.
Oh, right. I forgot how much you care about what people think. Prescribing cigarettes for inflammatory bowel? It causes lung cancer, you know.
You know why they have ribbons for breast cancer, colorectal?
But you care about what people... We're looking for it in the drawer with the epinephrine syringes in it.
Okay. Yeah. I'd like to clear my reputation.
Oh, right. I forgot how much you care about what people think. Prescribing cigarettes for inflammatory bowel? It causes lung cancer, you know.
You know why they have ribbons for breast cancer, colorectal cancer, prostate cancer, and not for lung cancer?
They ran out of colors.
Because people blame lung cancer patients. They smoked, they screwed up, they deserve to die. The reason people die from lung cancer is guilt.
Huh. Well, guilt does a lot of damage.
You said that with great significance.
You're not here to find your sins. You're not here to clear your reputation. You're here because you're having doubts. You might have screwed up.
I'm here because if I'm right, Cuddy is killing that patient.
Okay. But if you're wrong...
And she's saving her.
Fine. You're gonna have to go through every record of every patient who's been through this clinic in the last 2 days. And you're gonna have to hope that those records can be trusted. Which, by the way, yours can't.
These pills will help your kidneys function a little better, sister.
What's that?
104.
Is that good?
It's fine.
Oh, lots of wire.
I have to get this. My mother's been dead for 10 years.
But she's always with you in spirit. What do you know about the nun?
Which one?
The cute one. I think she likes me. The sick one, obviously.
Her parents died when she was a child, and she's been with the church ever since.
What's she lying about?
Why do you say that?
I always say that. And the old nun thinks the sick nun is a big, fat nun liar. You know nuns. What do you think? How about nuns? You hate nuns. You can't hate someone if you don't know them.
Know any Nazis? Maybe I hate them on principle.
I have a theory about what makes good boys good. It's not because of some moral imperative. Good boys have the fear of God put into them. The Catholic Church specializes in that kind of training. To make good boys afraid of divine retribution, so they'll do what their daddies tell them. For example, when you're in medical school, what's the last thing they want to do?
I think if she did have a secret, her boss would know.
Did you paint or put in new carpets recently?
No.
She never got access to drugs.
Well, we lock all our medications in the infirmary, and we don't keep prescription drugs here. Why haven't you asked Sister Augustine about these things directly?
I found that when you want to know the truth about someone, that someone is probably the last person you should ask.
And have you been speaking to Sister Eucharist?
She ratted out her fellow sister pretty quickly. If I were you, I'd have her repeat a year in nun school.
Becoming a nun doesn't make you a saint.
Becoming a doctor doesn't make you a healer.
And just because we live in a monastery and we spend most of our time in prayer doesn't mean we don't find time for drama.
So what is the sick one's drama?
Sister Augustine lived in Catholic foster care until she came to us. Tea?
Sure. Do all of you lie? It's good strategy. It's simple. Tell the same lie. She has not spent her entire life as a good Catholic. When she had a cardiac arrest, I had to open her blouse to do CPR, and I learned 2 things. Nuns can have nice breasts, and she has a tattoo on her shoulder of a skunk. Now, maybe it's the sacred skunk of Joseph. As far as I know, Catholic foster care and monasteries do not keep tattoo parlors or refectories.
We consider that our life begins when we put on our habits and take our vows. What happens before then?
It's irrelevant to you, but it's relevant to me.
Sister Augustine went into foster care when she was 6 years old, but she left when she was 12. She lived in the streets, she got into drugs. When she was 15, she became pregnant, tried to self-abort. She lost the child, she became ill. We took her in when she came back. If we had thought it was medically relevant, we would have told you.
It's not. This tea is delicious. Local herbs?
Any change with the medication?
Yes, she's getting worse. Lung function's deteriorating, BUN and creatinine continuing to rise. She's starting to run a fever and the rash is spreading. This rash is not gonna make Christmas.
Maybe House was right. Maybe there is an underlying condition that explains the symptoms, something we haven't considered.
Like what? It could be a metabolic disorder.
Specifically?
Epigenetic. Specifically?
I'm just saying.
You're just saying you think House is right.
Might be right.
Of course he might be right. It might be the hand of God at work. Don't say it's something else unless you've got something concrete to offer. What's this, hemlock?
I'm gonna do you the biggest favor one doctor could do another. I'm gonna stop you from killing your patient. It's a big word, T. Great for that little pick-me-up we're all looking for in the morning. Opens the lungs, increases the blood pressure, stimulates the heart. Unfortunately, if you then get injected with even 0.1 cc of epinephrine, instant cardiac arrest. Still, what the hell, it tastes great.
Sister Augustine
Has been drinking it religiously, so to speak.
Take the cardiac arrest out of the equation.
All the rest of the symptoms can be explained by a severe long-term allergic reaction.
That's what Cameron said in the beginning.
Yes, she did. Well done. But your unwillingness to stick by your diagnosis almost killed this woman. Take a lesson from Foreman. Stand up for what you believe. Okay, let's go figure out how to save a nun.
Damned if you do, damned if you don't.
It's been untreated for so long, it's gone from a simple watery eyes, scratchy throat allergy to a whopping I'm gonna kick your ass allergy, compromising her immune system, diminishing her ability to heal, and breaking down her organ system. So, what's the source?
The dish soap.
No. Symptoms persisted days after the dishwashing episode. It's gotta be something she's been exposed to here in the hospital as well as the monastery.
What about the tea? It caused her arrhythmia.
It could be, but it's not definitive.
We'll skin test for allergens.
Not yet. She's too reactive. She tests positive to everything. We need to stabilize her, isolate her from all possible allergens, give her system a rest.
Get her in a clean room.
Okay, and we'll gradually introduce allergens and see how she responds. When she reacts to something, we'll know that's what's killing her.
There you go. No television, no books.
Bye.
I'm afraid not. This room has filtered air, filtered water, even have silk sheets. Very decadent and hypoallergenic. You should be feeling better here.
We'll be back to check on you in a little bit.
Can the other sisters come in and pray with me?
It'd be better if you don't have any visitors. Once we isolate what's causing the allergy, then we can be a little more lax. I can pray with you.
I don't want to die. Why has he left me?
I was in seminary school. They asked us once what our favorite passage was. I chose 1 Peter chapter 1, verse 7. These trials only test your faith to see whether or not it is strong and pure. Your faith is being tested. As fire tests gold and purifies it.
And your faith is far more precious to the Lord than mere gold. So if your faith remains strong after being tested, it will bring you much praise and glory and honor on the day of his return.
He hasn't left you. The only thing in the way of you knowing he's there is your fear. You have a choice. Faith or fear. That's the test.
Choosing faith doesn't mean I won't die.
But it will affect how you experience your death. And therefore, it's up to you.
Why did you leave seminary school?
That test. You passed. I didn't.
She'll call you if anything changes. Will she be all right?
As long as she's not exposed to anything that can aggravate her allergy, she'll be fine.
Some help in here. Where is the procedure? She's in anaphylactic shock. No way, she's in the damn clean room. You kidding me? Get in here. 0.1 cc, Betty. She's about to intubate.
I got it. With the ambulance. I'm in. Breathing stabilized.
It's a clean room.
How do you get an allergic reaction in a clean room?
Maybe it was the preservatives in the IV.
Check that.
Latex tubing?
Check that. Check everything.
Well, it could be mast cell leukemia. It can cause anaphylaxis.
Check the blood levels. It's not eosinophilia or idiopathic anaphylaxis.
Maybe it's just divine will.
It's not my will.
You do realize, if you're wrong about the big picture, that is, you're going to burn, right?
What do you want me to do? Just accept it, pack it in?
Yeah. I want you to accept that sometimes patients die against all reason, and sometimes they get better against all reason.
They don't. They just don't know the reason.
I think the nuns would agree with you on that.
I just wanted to say that I know that you did everything you could.
I don't need verification from you to know that I'm doing my job well. That's your problem, not mine.
I was just being nice.
You don't need to always do that.
Merry Christmas.
Sister Augustine's been extubated.
Good.
She's requested to check out against medical advice. She wants to go back to the monastery.
Well, talk her out of it.
I think I may have talked her into it.
Room's paid up for the rest of the week. Might as well stick around.
This illness is a testament to his will to take me. It doesn't matter where I am. I can accept that.
Does anybody believe anything you say? You're not accepting. You're running away. Just like you always do. Ran away from the monastery, get laid. Ran away from the real world when getting laid didn't work out so good. Things aren't working out again, so off you go.
Why is it so difficult for you to believe in God?
What I have difficulty with is the whole concept of belief. Faith isn't based on logic and experience.
I experience God on a daily basis. The miracle of life all around. The miracle of birth. The miracle of love. He is always with me.
Where's the miracle in delivering a crack-addicted baby? And watching her mother abandon her because she needs another score. Miracle of love. You're over twice as likely to be killed by the person you love than by a stranger.
Are you trying to talk me out of my faith?
You can have all the faith you want in spirits and the afterlife, and heaven and hell. But when it comes to this world, what can you do? Because least you can tell me that you put your faith in God to get you through the day. When it comes time to cross the road, I know you look both ways.
I don't believe he is inside me and is going to save me. I believe he is inside me whether I live or die.
You might as well live. Got a better shot betting on me than on him.
I was on every kind of birth control known to man. And I still got pregnant. I blamed God. I hated him for ruining my life. But I realized something. You can't be angry with God and not believe in him at the same time. No one can. Not even you, Dr. House.
How'd it go?
She has God inside her. Been easier to deal with a tumor.
Maybe she's allergic to God.
Looked everywhere for an allergen that could be causing this reaction except one place, inside her.
Well, medical history, she didn't mention any surgery.
He had one.
Can we get the records? What hospital was it at?
They didn't have it at a hospital. Order a full body scan.
What if she refuses?
Tell her I'm looking for a miracle.
No piercings, no fillings, no implants.
It's clean as a whistle.
What's that looking for? What is that? Don't know. Get a 3D representation.
Oh my God.
The copper cross, a form of birth control pulled off the market in the 80s.
So she's allergic to copper.
Rare, but it happens.
Does she know she had an IUD?
She had an abortion. IUD must have been left in, embedded in the endometrial tissue where it couldn't be detected.
So all we have to do is remove the IUD. Then the symptoms should subside.
I got this IUD when I was 15. It's been more than 20 years.
No prolonged exposure to an allergen with minimal symptoms. But at some point, all it takes is one last contact to cause a full-blown reaction. It's like a balloon filled with air, one last breath. It explodes.
The first time I got the rash was when I was washing the car.
And all your subsequent symptoms came from ingesting food prepared in it.
The house found his miracle.
I doubt he'll interpret it that way.
You told me your favorite passage. Would you like to hear mine? Celebrate with blood, because your brother was dead and is alive again.
The prodigal son.
I'll be waiting for you when you're ready.
We'll schedule your surgery for tomorrow.
Sixth circle of hell.
Confined in a sweatbox with a bloody nose and all the tissues are soggy.
I think that's the seventh.
No, 7.
God, we must be fun at parties.
Both broken clawing.
How's the sister?
Heart rate is normal, kidneys function. You know how it is with nuns who take out their IUDs and just bounce right back.
Great.
Told you I didn't screw up.
You screwed up.
I gave her 0.1 cc of epinephrine.
Yeah, and if Cuddy hadn't taken you off the case, you would have killed her. You want to come over for Christmas dinner?
You're Jewish.
Yeah, Hanukkah dinner. What do you care? It's food, it's people.
No thanks.
Maybe I'll come to your place.
Your wife doesn't mind being alone at Christmas.
I don't want to talk about that.
Why?
You did good with the nun. Congratulations.
Thank you.
Merry Christmas, Dr. House. Dr. Wilson.
Good night.
cat got your tongue? You killed him. Cut off his head.
I need to take a look at this.
Mom? 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 It's okay.
Just a couple of questions before I could authorize extending her disability benefits.
I don't like her. She's fat.
I could lose a little weight.
You all right?
Actually, before she sighs,
I killed the cat. Lots of blood.
It's okay.
I have a couple of questions about some of these dates. The first diagnosis...
Schizophrenia. Dr. Walters, May 11 last year. The letter's in the medical file.
And April 6th, that was the last day she worked, but she received unemployment benefits for that week.
We fixed that. I know we did. We returned the money. That's the canceled check, not the real one. You know, it's a copy.
And you're the dependent?
No. That's my little brother. I'm 18, just helping out.
You're all set. Just need a signature.
Hey, I'm talking to you. The cat's first. Now it's your turn, Lucy.
Shut up! Shut up! Shut up!
It's okay. She just needs a little water. That's all.
I'll go get it.
Just hold on, okay? Just when she comes back, sign it, and we're gonna be done. We need this, okay? Please. Okay.
The voices.
The voices aren't real. What? Mom? 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 Mom!
Caucasian woman, status post-respiratory arrest in the field, intubated, oxygenating poorly.
This is a good hospital?
Depends what you mean by good. I like these chairs.
How is she?
Stable. Okay. Your mom had a small pulmonary embolism. Blood clot that got stuck in her lungs. Blocked the oxygen.
But the pain started in her leg.
Where the clot started, her calf. It's called a deep vein thrombosis. Basically, a bigger clot.
It never hurt there before. I would have noticed.
A piece of that broke off, went up the vein through her heart and blocked the blood flow to her lungs. No blood flow, no oxygen. Is your dad here? I have some things I need to talk to him.
My dad's running a little late. He's dead. Just talk to me. I'll take care of him.
All right. Your mom's blood alcohol was 0.12, 10:30 in the morning.
I gave it to her. 2 ounces of vodka, it cools her out. But that's first since Monday. That was 3 days ago. I've been real careful. She hears voices.
She's schizophrenic. Explains the DVT. The alcohol makes her pass out. She's immobile for long periods of time.
That doesn't happen. She's not an alcoholic.
She only drinks when you give it to her. We put her on blood thinners. You can probably take her home tomorrow.
It's not the alcohol. It's got to be something else.
Of course it's the alcohol. Hello! This guy's a professional doctor. Plays golf and everything, I bet. He's not gonna tell you your mom's an alcoholic without proof. I'm sure he scoped the varices, checked her esophagus, ran all kinds of blood tests. Doctors like this, they don't make assumptions. They do the work.
I'd be happy to refer you the case, Dr. House. You seem so interested.
What kids? It's over. I'm sending her home. How old is she?
You're a doctor?
On my own stethoscope. Did I ask you how old she was? I forget. 38-year-old woman with no previous symptoms or history presents with deep vein thrombosis. How did she get it?
Oral contraceptives, smoking, diabetes, obesity, and what's the point here? A DVT is a DVT. Put on IV heparin to prevent future clots. And what's the big mystery?
Fine. We're all sleepy. You need a clue. She's 38 years old. She's 20 years too young to get a deep vein thrombosis.
I treated a 12-year-old girl once. Soccer player. She got kicked in the leg.
There was no trauma. None of the risk factors.
You took a history.
I have some notes. They're not mine, but reliable, I think, for the purposes of this discussion. As for the immobility, well, she's real active right now, of course. Paranoia keeps her limber.
Paranoia?
Oh, yeah. She's schizophrenic. And her kid wrote this, so it might be a little biased. You know, having to take care of his nutso mom and all. You think there's a connection? Do we include schizophrenia in the differential for DVT? The answer is no. Abnormal dopaminergic pathways in the brain cause blood clots. Schizophrenia is not the cause of DVT. On the other hand, we don't really know anything about schizophrenia, so maybe it is connected.
Well, schizophrenia explains one mystery, while you're so fascinated by a woman with a bump in her leg. It's like Picasso deciding to whitewash a fence.
Thanks. I'm more of a Leroy Neiman man. And it is only about the DVT. She's 38 years old.
Right,
She should
solve this one and you're on your way to Stockholm.
We don't even know how to treat it. Come on, fumigation of the vagina?
A little louder. I don't think everyone treats it.
2,000 years ago, that's how Galen treated schizophrenics. The Marcus Welby of ancient Greece.
Well, clearly you're not interested.
Oh, I'm interested. I'm interested in how voices in the head can be caused by malposition of the uterus.
It's a better place for it?
Now what do we got? We got lobotomies, rubber rooms, electric shocks. My, that Galen was so primitive.
Where are you going?
See the patient. That all-important human connection. Thought I'd give it a whirl.
You won't talk to patients because they lie. I'll give you a patient with no concept of reality.
If it wasn't for Socrates, that raving, untreated schizophrenic, we wouldn't have the Socratic method, the best way of teaching everything, apart from juggling chainsaws. Without Isaac Newton, we'd be floating on the ceiling.
Dodging a chainsaws, no doubt.
And that guitar player in an English band was great. You think I'm interested because of the schizophrenia?
Yeah, pretty sure.
Galen was pretty sure about the fumigation. Pink Floyd.
This is Dr.
Gregory House. Nice to meet you. It'd be all right if we spoke alone for a while.
Well, you're gonna need me to...
I got your case notes, Doctor. There's a cafeteria downstairs. Get yourself whatever you want, as long as there's enough left over for a Reuben sandwich, dry, no fries, hold your pills. Should bring you about $5.80 with tax. I'll page you when we're done.
No. Pickles.
Nice kid. How much do you really drink?
It's when you're talking to a patient.
I don't know who I am anymore.
It's a blood clot. What's so fascinating about that?
He likes crazy people. Likes the way they think.
They think badly. That's the definition of crazy. Why would he like...
They're not boring. He likes that.
And meds?
Baseball. I like baseball. Very sad. My boy and me. See you again.
Not meds. Meds. Medicine. Take what he tells you to take.
No one believes me.
I do.
I thought he liked rationality.